today on 31st May 2021, we have prepared a short video related to No Tobacco Day 2021. It's a futile effort from our part to spread awareness regarding the effects of tobacco and smoking on our health and the environment. Today I, Prashriya Singh,
Mayusha Bandari,
Meeta Bhattacharya,
Anushka Shakya,
Chanda Maharjan,
Sisam Khanal,
Jyotsana Thakur.
we will be trying to comprehend the message of this year's theme, Commit to Quit, through this short video. Before talking about this year's theme, let's talk about the problem itself. Smoking. Smoking is the act of inhaling and exhaling the fumes of burning plant material. A variety of plant materials are used for smoking, including marijuana and hashish, but the act is most commonly associated with tobacco, as it is smoked in a cigarette, cigars, pipes, and even in hookah. Tobacco contains nicotine, an alkaloid that is addictive and can have both stimulating and tranquilizing psychoactive effects. The smoking of tobacco, long practiced by American Indians, was introduced to Europe by Christopher Columbus and other explorers. Smoking soon spread to other areas, and today it is widely practiced around the world despite medical, social, and religious arguments against it.
Effects of tobacco on health. Tobacco use leads most commonly to a disease affecting the heart, liver, and the lungs. Tobacco use is the single greatest cause of preventable death globally. The longer you smoke, the more symptoms you are seemingly to strengthen. Some of the effects are effects of respiratory system. Smoking can cause respiratory disease like chronic bronchitis, asthma, tuberculosis, pneumonia, shortness of breath, etc. When a person smokes, the tobacco makes blockage in the lungs and gradually develops into lung cancer. Effects of cancer. Tobacco leads to the most commonly to disease affecting the lungs, while smoking being a major risk factor for cancer. If we lose the battle against tobacco, we will lose the war against cancer. Effect of smoking during COVID-19. Current evidence suggests that the severity of the COVID-19 disease is higher among the smokers. Smoking impairs lung function, making it more difficult for the body to fight off respiratory disease due to new coronavirus. Tobacco users have a higher risk of being infected with the virus through the mouth while smoking cigarettes or using other products. If the smokers contact the COVID-19 virus, they face a greater risk of getting a severe infection as their lungs health is already destroyed.
World No Tobacco Day was created by the members of the WHO in 1987 to draw global attention to the tobacco epidemic and the preventable death and disease it causes. It is further intended to draw attention to the widespread prevalence of tobacco use and to negative health effects which currently leads to more than 8 million deaths each year worldwide, including 1.2 million are the results of non-smokers being exposed to second-hand smoke. In 1987, the WHO's World Health Assembly passed Resolution WHA 40.38, calling for 7 April 1988 to be a World No Smoking Day. The objective of this day was to urge tobacco users worldwide to abstain from using tobacco products for 24 hours, an action they hoped would provide assistance for those trying to quit. In 1988, Resolution WHA 42.19 was passed by the World Health Assembly, calling for the celebration of World No Tobacco Day every year on 31st May. Since then, the WHO has supported the World No Tobacco Day every year, linking each year to a different tobacco-related theme. In 2008, on the eve of the World No Tobacco Day, the WHO called for a worldwide ban on all tobacco advertising, promotion, and sponsorships. Many governments use World No Tobacco Day as the start date for implementing new smoking bans and tobacco control efforts. For example, on 31st May 2008, a section of the Smoke-Free Ontario Act came into effect, banning tobacco power walls and displays at the stores in this Canadian province. And all the hospitals and government offices in Australia became smoke-free on 31st May 2010.
Commit to Quit. On May 31st, the world celebrates the World No Tobacco Day. This day demarcates the efforts from people all around the world to bring about a gradual, exemplary changes in our lives as well as the environment. Smoking came to be viewed in a decidedly negative light, especially in the Western countries, and has been a growing problem all around the world, hampering health, environment, and many more. Eradicating it has been a difficult and a fragmentary task. Every year, WHO launches a year-long campaign globally in a step to aid to quitting tobacco and smoking. This year's theme, Commit to Quit, has set another aid and abet for the betterment of lives all around the globe. To commit into something is to confide and devote oneself into a course or a policy. Quitting tobacco is a task that is very challenging. The current situation with COVID 19 also doesn't really help the condition. As the stress piles up, people try to release it in one way or the other, and smoking and chewing tobacco has been one of them. On the report of WHO, worldwide around 780 million people say they want to quit, but only 30% of them have access to the tools that can help them do so. According to the WHO, this year's theme and global campaign will support at least 100 million people as they try to give up tobacco through communities of quit. So, this year's campaign, that is to be conducted by WHO and multiple partners, will be providing people globally the tools and resources they need to make a successful quit attempt. As all of us know, the number of COVID 19 cases are rising day after day. It has affected not only the physical health but also the mental status of a person. Smoking, chewing tobacco generally does impact health, but it also substantially increases the effect of COVID symptoms. To avoid these life threatening hazards, the main goal of this campaign is to help create a future where tobacco use is not leading cause of preventable death, said by DPH Commissioner Dr. Raul Pino, providing three major tools and ingredients for quitting smoking, like talk to your doctor, use all available resources, and stick to the plan. This campaign helps for the better and progressing good to provide environments conducive to quitting smoking, a small change to bring about greater movement for a much brighter and significant future. Be the change to see the change. Commit to quit.
Objectives of No Tobacco Day to prevent the use of tobacco among young people by increasing public awareness on the consequences of the tobacco used, by increasing anti-tobacco policies and programs in schools, by increasing the price of tobacco products, to protect from exposure to environmental tobacco smoke, by increasing awareness on the harmful effects of environmental tobacco smoke, by reducing exposure to environmental tobacco smoke in indoor and outdoor public areas, by controlling the contents and emissions of tobacco products, to promote cessation among smokers, by increasing awareness and intentions to quit among smokers, by increasing awareness among health professionals on smoking cessation programs.
Now let's discuss about the outcome of No Tobacco Day. As we know, after the No Tobacco Day has been implemented, many changes has been seen throughout the world. At first, the starting point of kicking the habit is the awareness for the harm that can be caused by the smoking. For example, in 1964, after the US Surgeon General report brought the public awareness, since 2000, many cities, states, regions worldwide, including New York City in 2003, Scotland in 2006, Nairobi in 2007, and Chicago in 2008, have implemented complete smoking bans in restaurants, taverns, and enclosed workplaces. A ban introduced in 2001 in China, which was home to one-third of the global smoking population, banned smoking in hotels, restaurants, and other indoor public places. Therefore, we can say that since 2000, smoking rate was one half that of 1960. In addition, many countries are implementing smoking bans in workplaces, in hotels, including Norway, New Zealand in 2004, and France and India in 2008. Bhutan became the first country to ban both smoking in public places as well as sales of tobacco in their country. After that, Also, the Canada adopted strong graphic warnings on cigarette packaging. By that also, it decreased the rate of consumer of nicotine as people find it toxic to their health. Therefore, we can say that the No Tobacco Day has positively affected the health of the individual in many good aspects.
So on the occasion of World No Tobacco Day 2021, I here present you a poem. So my topic is Dhua Sarathi. Dhua, which means smoke, Sarathi, which means friend. So Dhua Sarathi. So here it goes. उठेर मनमा दुविधा बोकेर खोक्ने घाँटी र खोक्को फोक्सोलाई सोचको भुमरीमा धकेलेर म सर्लक्क तान्छु त्यो धुवाको एक मुस्लो। सबेरै उठेर मनमा दुविधा बोकेर खोक्ने घाँटी र खोक्को फोक्सोलाई सोचको भुमरीमा धकेलेर म सर्लक्क तान्छु त्यो धुवाको एक मुस्लो। खोकीलाई दबाएर म फुक्छु त्यो धुवा जसमा मेरो छोरीको रुन्ची आकृति धमिलिँदै भन्छ बुवा अब छोड्नुस् है। म त शौखिन राजसिक र बेमतलबी मान्छे। म त शौखिन राजसिक र बेमतलबी मान्छे। त्यो ठुटाको अन्त्यबाट मेरो दिन प्रारम्भ हुन्छ त्यो बिहानको सगुन म कसरी त्याग्नु। असरल परेको सोच र चित्त दुखाइहरूलाई समेटेर म फेरि अर्को सर्को तान्छु अनि त्यस सर्को सँगै जवानी प्रेम सम्बन्ध र आत्मीयता उडेको सम्झन्छु। म शोकमा तान्छु, शोकमा तान्छु, भोकमा तान्छु, होसमा तान्छु। म शोकमा तान्छु, शोकमा तान्छु, भोकमा तान्छु, होसमा तान्छु। हठात म सपनाबाट तर्सन्छु। मैले गुमाएका सबैजना सम्झन्छु र पाएका स्किल्लीहरू पनि सम्झन्छु। मलाई जवानी दिने मेरी अर्धाङ्गिनी, मलाई जीवन दिने आमा बा र मेरो जीवन बन्ने छोरीको मूल्य यो तुच्छ एक खिल्लीले कसरी चुकाउन सक्ला र। निसन्देह अब म फोक्सोमा सपना भरेर निराशाहरूलाई उठाउने छु। डर, घृणा र सन्देहलाई चिन्तनमा बदल्ने छु। अब सबै चिज बदल्ने छ किनकि म आफै बदल्ने छु। अब सबै चिज बदल्ने छ किनकि म आफै बदल्ने छु। थ्याङ्क यू।
Tobacco, as we all learned, has a chronic effect not only on health but social, economical, and mental state are equally affected. The World No Tobacco Day is celebrated worldwide by different awareness programs, short films, drawing competition, journal writing, door-to-door programs, etc. to awake the people to take one small step from their side and bring about a huge change globally and lead to a healthy and tobacco-free environment. Many plans and agendas are brought and implemented for its control and management. Marking this day, the WHO has brought the Empower scheme that monitors, protects, offers helps, warns, enforces required bans, and raises the taxes on the tobacco. The collective execution of these can bring the World No Tobacco Day a grand celebration. On an additional note, self-awareness, community awareness, and national state level plans play an important role in the success of the day as well as it serves the purpose of the zero tobacco consumption. Because if not now, then one more generation is pushed in the darkness of the tobacco addiction. Commit to quit. Together we can. Thank you.